and welcome to another amazing episode of Breaking Barriers, the Mental Health Podcast. My name is Camila.
And I'm Lizzie. And today we are joined by a very special guest. He is a physician for over 25 years now, board certified in family medicine, and also board certified in obesity medicine. And we have Dr. Manuel Torres here today.
Hi, guys.
Hi.
Thank you.
It's a pleasure to be here.
Thank you for coming.
Thank you.
Sure.
He's not just a board certified physician, but also a father of 4 amazing children.
Correct.
Which, wow.
Yes, from 23 to 7. So
Wow.
been I guess a physician 2 years longer than I've been a dad. And it's Father's Day, so it's a great weekend, right? So
nice one.
happy to celebrate
Father's
that once
Day
again.
to you.
Thank you for spending
it's good.
that special day
Oh,
here
that's
with
okay.
us.
That's okay.
Yeah.
So, but it's been an adventure. It's been an adventure for sure.
So 4 amazing kids. Your
Yes.
youngest is special needs.
Yes. Francesco.
Yes.
He is what we fight for every day. He is a special needs child. He was challenged by a brain tumor that we diagnosed. That I started to notice some abnormalities with him very early on, about 6 months of age, and we moved mountains to get him diagnosed. And long story short, he had surgery at about 14 months of age. Had his brain tumor removed, mostly, and thank God things were benign. We unfortunately lived the nightmare of thinking that he had cancer for about 12 hours there. So it was a scary moment, a very scary moment as a dad and as a doctor, and that's created a very interesting dynamic because Nicholas Children's Hospital was fantastic with us and very respectful of my involvement. So we moved fast, and he suffers with seizures. He has seizures, unfortunately, multiple times during the week still. And he is under the influence of what is left of his brain tumor because we couldn't remove it completely. He's under the influence of his medications, and then he's under the influence of his epilepsy. So that really sort of developed his behavioral disorders and what has been now diagnosed as autism as well. So, he's autistic, epileptic, and all those challenges. And, we developed sort of this mantra of fight for Francesco, and it's how we live our lives. And he's sort of has defined our purpose for all of us, actually, even for the older kids, which is very important. The older kids were either, teenagers or preteens when Francesco was diagnosed. So the dynamic of them having to sort of identify that now, not only does the new child have all the attention, but all the complexities that came with that. So it sparked interest in my middle daughter being interested in medicine, and now maybe even my other son as well. And, so it really has generated a lot of positive, and we've been able to build a world of support around Francesco and be able to translate that to other kids in the community, which has been great. So we sort of live to tell his story. This is hopefully a part of that today,
Absolutely.
Right? So we can, share his story and hopefully motivate other people and sort of the effects of the family dynamics when it comes to dealing with a catastrophe, because it was definitely a catastrophe.
Do you think that being in the medical field has helped you and the family to understand the process?
Well, yes. I mean, there's a lot of pluses and minuses because a common defense mechanism is to intellectualize, right? So, that's Dr. Google, right? That's what we all do, from any sort of simple headache or dizziness or whatever it may be, any symptom you're Googling to figure out, and that happens to all of us. Of course, when I'm doing that or when that happens to me, because it's human nature to try to intellectualize yourself about the scenario. Of course, I was reading things that I very, very, very much understood what the possibilities were. And as a matter of fact, the early on was trying to diagnose.
Right.
So I knew something was wrong.
You didn't know what?
I didn't know what. It was really, 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 really tough because I started to understand that it was going to be a very, to use the word again, catastrophic situation. Sharing that with my wife.
I was going to ask you that.
Correct. Because she's in the medical field as well, not as a provider, but as an administrator. And she has, a vast knowledge of scenarios. And as a mom, sort of having to, and I still remember having to sit her down and say, listen, I'm going to be doctor for a second. I'm going to not be dad, not be husband. I need to speak about Francesco to you as a physician.
Right.
And that was before everything was diagnosed. And A, B, C, D, E, F, G, this is what I think is going on.
Right.
We need to move, like not move physically, but move in terms of action of what we need to do to diagnose him. So, again, we built a team around him. Nicholas Children's was phenomenal. And it was comforting that in that scenario that they accepted my input. They accepted my participation. As he went through surgery, the complexities of him having brain surgery and those 2 or 3 scary weeks being in a neurologic intensive care unit was really tough. But you learn and you adapt as best you can, and you sort of try to compartmentalize your education and your knowledge and your experience, and let the doctors be doctors. And they reciprocated that in a really professional way so that we can intervene and identify, potential pitfalls and difficulties in that time frame now. And then even today, his pediatric neurologist and I are friends and colleagues, and we have that dynamic. So yes, being a physician has given us that opportunity. It is unique, and I'm respectful of that. I don't abuse it. At least I don't think I do. I wish all patients had that kind of engagement, but it's just not the case. So it helps Francesco. And truthfully, what I learn, I try to share as best I can, again, through Francesco's stories and through opportunities for improvement for kids like Francesco.
Because we see so many misdiagnosed or undiagnosed children, especially as they start those developing stages.
Correct.
Sometimes it's hard to pick up the right signs, the right symptoms, to the right diagnosis, because a lot of things can be mixed up.
Yeah,
so.
I mean, a common thing that you'll see, and I see this more on the provider side, is the challenges with denial, maybe.
Yes.
You don't want to have an unhealthy child. Nobody wants to have an unhealthy child. It's hard to admit that you have an unhealthy child. I remember very clearly having that vision of what your child is going to be, and that new parent feeling, and my child's going to be the greatest.
And those
he's going to throw touchdown passes,
dreams that you have.
and he's going to, whatever, and all of that, boom, goes away immediately. And it's like, wait a second, you have to pump the brakes on that, and then you have to go into a mode of survival, I guess, of protection, of intervening. And then trying to manage the dynamics of your family, so that everybody else, understands why the focus is now on Francesco.
Right.
Why work, had to sort of be put on pause as well. My responsibilities to my patients. At that time, I was working for Baptist Health, which was exceptional with that, and they were very extraordinarily helpful with their influence and opportunity. So obviously we used that to the advantages of our son.
Absolutely.
So they were extraordinarily supportive. And I was able to focus our attention, and we've all grown from it. We've all, it's hard to say, but Francesco probably has brought us closer. Francesco has brought us greater opportunities. Fortunately or unfortunately, all of our decisions are Francesco first type of decisions. Travel and weekends and days and even routines, and even
it changed the dynamic.
They changed the dynamics of the family completely. So that was a life-changing scenario that we went through about 7 years ago. He's now 7 years old and he's doing well. Again, fight for Francesco is sort of our mantra, and it really is a fight. I've gotten involved with the Epilepsy Alliance Florida. I'm on their board.
I want to talk about that for a second.
Correct.
I am also a parent, and I just had my second child, who's just now 13 months.
It's Camila, right?
Camila. Yeah,
Wonder where you got that
name. And I cannot imagine how incredibly difficult it was what you went through.
Yeah.
I think it's every parent's nightmare.
Yeah.
And I I'm getting all choked up, but I can't imagine. Yeah. I can't even imagine how incredibly difficult that must have been. Like you said, every parent has this vision of what their child is going to be, what they're going to do with their life. And then you are going through something catastrophic, as you said. And you have to navigate through all of that. And, you have also, you're balancing your work. You're a physician. You're balancing your personal life. What do you do for your own mental health and well-being?
I mean, now it's different because now things are much more calm. At that time, there's no time for that. You really, every parent will tell you, I'm sure, you've lived that experience as well. Like it's a situation where you really put yourself last. And that, I'm sure we're going to talk about that later in terms of behavioral health, and this is a behavioral health podcast. So, you not only do you put your nutrition behind, not only do you put your exercise behind, you're maybe even taking your own medications, but you definitely will put your own
are no longer a priority.
Your psychological well-being is definitely put on hold.
And you don't even do it intentionally. It's just like you don't have the time to think even about yourself.
Correct. And the decisions that we were trying to make were, life-changing decisions for our son. And he's so early on. I mean, all of this happened within the first 6 or 7 months of his life. Francesco was born in December. By July 4th weekend was really that weekend where, like I told you, I sat my wife Julia down and I said, listen, Julia had to work, so I was with him for the weekend, and I just decided I'm going to observe him like a physician. And, I do family practice, so I have some pediatric training. I'm not a pediatrician, obviously, but, I had enough comfort and experience that he was vomiting and having regurgitation. We thought he had what are called infantile spasms. It really hadn't come to my forefront in my ability as a diagnostician to diagnose what's going on, that this is an epileptic situation that I have on my hands. And it was that weekend, that long weekend of her working all weekend, where, I came to the realization that, things are going to change.
Something as well.
You see the tidal wave.
Yeah.
And lo and behold, within a month of that time, we were already doing some therapy with Francesco and et cetera. We very quickly got to this point where he was starting to have really significant, what, any person would think is a seizure. His seizure type at that time, if I could probably put it this way better, was very subtle.
Like absence seizure?
Well, he has what's called gelastic seizures. So let me try to explain. He has what's called a hypothalamic hamartoma. A hypothalamic hamartoma is a benign brain tumor that grows on your hypothalamus. Our hypothalamus is sort of the core of our brain. It is what really controls our personality. It controls our sexual drive, controls hunger, controls thirst. It's really sort of the core of who we are. It really affects who you are as a human being. It's kind of like that movie with the little characters, right? And it's in the center of your brain. So it dictates the seizure pattern called gelastic seizures, which are laughing seizures. Most children with hypothalamic hamartomas are diagnosed with early onset puberty when they're about 9 or 10 years old. So you have a 9 or 10-year-old that starts to have like puberty changes, in the female, the breast buds and pubic hair, whatever, and in the males, etc., same things, right? So similar things. And, parents become concerned because, wait a second, this is happening too early. And as you begin to question and retrospect and diagnose, the patient may have a history of laughing funny. And then they're like, oh yeah, hold on. Yes, my kid has a weird laugh. Like he sort of laughs at odd times and laughs irregularly, or may laugh. And it's kind of like a hey, like sort of a repetitive, sort of almost like a weird giggle. And Francesco was doing that. But again, as most parents, we just thought he laughed funny.
Right.
So one of the first questions when the neurosurgeon came in once he was hospitalized because his seizures progressed so rapidly was, does he laugh funny? And we were like, yeah, absolutely. And that, was one of the things that really cued the neurosurgeon into say, this is not cancer. This is a hypothalamic hamartoma. This is a benign scenario. This isn't going to be as catastrophic as you think, but your son is going to need surgery. He had a very large hypothalamic hamartoma. By the way, there's only about 300 kids in the United States that have hypothalamic hamartoma. There's only about 300,000 in the world that we know of. It's extraordinarily
300
rare.
kids in the United States?
As far as I remember, yeah. So if you go to like hypothalamic, Hope for HH, I think is a foundation that's out of the West, California. I think it's about that number. It's extraordinarily rare. It's recognized as like a rare disease. But anyway, so he had such an acute presentation because he was having such significant seizures.
Wow.
So the seizures don't typically progress as the child goes through pubescent changes in that precocious fashion. So that's when the seizures sort of expand. And he was having really significant seizures very quickly.
Thinking, Francesco, he's your fourth child.
Correct,
right?
correct.
So also, there's parents that there's the first child, and it's more difficult to pick up any abnormality, any signs as they're developing. But when you have raise other children, you can be, okay, this is not the norm.
Yeah, and yeah, I mean, and it's kind of like all parents. I mean, parents that have multiple kids will tell you, like, I'm the youngest of five. Like, my parents, I'm the youngest of five. My parents, whatever. Like, like, you're sort of the afterthought, you know what I mean?
Afterthought.
You're like, at that point, it's like, yeah, whatever, do whatever you want, So...
just don't let the knives and scissors are on him, but he can have them.
Roll him around. He'll be all right. But anyway, yeah, so, again, we had gone through a lot of things to get to Francesco. I had personally gone through a lot of things from a career standpoint, whatever. Julia as well. We've achieved a lot of things. Francesco was sort of like an awesome opportunity and like a prize and like a fantastic, like, this is going to be great, and we welcomed him with that. When Julia got pregnant, like, that was the, awesome, idea, and all of that just comes to a grinding halt. Absolute grinding halt. And I remember very clearly the many sleepless nights. One of the first sleepless nights was me realizing, holy smokes, like, my kid's never going to do those things, and he's never going to achieve those things, and that's just not who he's going to be. It's not to say that he's not going to achieve other things, and you never say never and all those things, but it's just your dynamic of what you have this idea for your child and your future just completely changes. And by the way, it comes out of your control, which is very important. And it's very important in patient care too. Like, it, again, as a physician, to get back to that, like, it taught me that lesson. Like, there's just things that you can't control. There's things that you sort of have to learn. I would, I think I guess as most of us are as physicians, I guess probably a little bit of a control freak. Like, you sort of understand what you can control and what the dynamics are, and sort of the influence that you may have on patient care, and whether it's through medication or therapy or surgery or whatever it may be. You sort of get to a point where, like, okay, well, this is the scenario I'm presented with. How do I diagnose it and improve it? And even now, as his seizures fluctuate, there's good days and bad days, and he's on multiple medications, and he'll have a pattern where he'll begin to break through, and the seizure frequency will increase. So what's going on? And I again kick into the diagnostic phase, and kick into the management phase, if you will. And then begin to manipulate the scenario. Now, that's unique to us. That's unique to Francesco. We always, say, he's lucky we're his parents.
I was going to say, as a family structure,
correct.
He is in the best possible place that he could be.
So that's what motivates us to hopefully get Francesco's story out. That's why we work
very
so closely to raise money with the Epilepsy Foundation, because not everybody has that, and you need that parents and people and families struggle massively when they don't have resources. And there's medication anxiety, which we can talk about, right? Like, the refill coming in and what time, whatever. And, is it a controlled substance, insurance coverage, therapy sessions, whatever it may be. It really emphasizes how any chronic care condition, of which I treat a lot of them, really requires a multidisciplinary approach. If you really want to control and you really want to improve, you have to be willing to change things. You have to be willing to look at what are all the different disciplines that I need to address here so that things can get better, at least a little bit. Right. And then we'll see. So that's a little bit of Francesco's story and a little bit of our story with.
It's an incredible story. No, it truly is, because you're impacting so many lives. You have to know that it's not just like, this is your reality. Yeah. Francesco, but you're helping so many people in the process.
We hope so.
You are. Yeah. You are. Your work with Epilepsy Alliance Florida, I mean, I see you guys. I see what you do every single year. You fight every day of your lives.
We have the largest team.
You have the largest team.
We get beat out for raising money, but, we try to do what we can.
Maybe with this podcast, we're going to get it out even more, and you're going to have more people join your team.
So, but they're wonderful people that run that organization. My involvement is, of course, limited. They're wonderful people again that really help impact the families in the Florida community across the state to help. And it's, by the way, it's not just kids. It's adults as well. It's people living with epilepsy. This is an extraordinarily common disease. Nobody likes the scenario of epilepsy. It's it's always very shocking.
Frightening,
scary, but the people that live with them, maybe you sort of become accustomed to it and you manage it, and it's management, just like obesity is management.
Obesity
just
is
like
management.
Hypertension is management. Diabetes is management. These are chronic conditions that the human body lives with, and you develop. They're pathologies. So how do you manage these pathologies? And that's what 25 years of practicing medicine has really taught me, and maybe Francesco's scenario taught me to do that a little bit better. So we'll see. So far, so good, I guess.
Right. Thankfully, because of your experience as a physician, being a father, you had 3 older children at this point. Correct. And so, I mean, definitely all of that comes into play. I do want to touch on obesity that you just brought up. You are board certified in obesity medicine.
Correct.
And we know that obesity and mental health issues, there's a direct correlation there.
Yeah.
I was reading people that are obese are depressed.
Right.
People that are depressed tend to be obese, right? So there's a direct correlation.
Sure.
In your practice, how do you mitigate? So let's say you have a patient coming in. Well, you've treated, I don't even know how many hundreds of patients.
A lot. Tens of thousands, maybe. I mean, it's funny. It's 25 years. I did hospital medicine for mix of hospital and outpatient medicine for the first 10 years, and then eventually I was hired by Baptist and with a team of people started primary care. There was no Baptist Health Primary Care at that time, and I was part of the team, a very elaborative, very excellent team that built out primary care, Baptist Health Primary Care in this community, and it's been extraordinarily successful. I've since moved on and now work in a completely different place. Because of opportunities and so on, and because of Francesco, honestly, it sort of allowed me that ability to tend to him more. It's a challenge to try to get to that where you can begin to understand the dynamics of obesity. So to elaborate a little bit on how I got into obesity medicine, when you start talking to patients, obviously I like to talk. So as family medicine, you got to be a talker. As primary care, you got to be a talker. If you want to be successful and if you want your patients to really value your opinion and trust you
and comply
and take patients on a journey through their chronic condition, like you got to communicate with people and be a good communicator. We look for good communicators when we're training primary care providers, right? So the two things that people really wanted to talk about more than anything was their weight and their mental health, without a doubt. Maybe in the first few years, I was doing a lot of hospital medicine, but when I was sitting in the office, it was like, well, I had my heart attack, but now I need to lose 50 pounds. And, mom has Alzheimer's now, but I'm destroyed and my life, you know what I mean? I'm dealing with that. Help me. So in the outpatient setting, it became the number one and number two topic. So I said along the way, I really need to improve my education in regards to how to manage this. Being board certified in obesity medicine means something particular. It's not a recognized medical specialty like cardiology or rheumatology or whatever, but there is an organization that will, if you want to, as a primary care physician or as a nurse or as whatever, you can seek this extra training, take an exam, and then be able to say that you have a board certification.
You're an expert in that field.
And you're an expert in that field. So correct. So lesson number one for patients that are seeking that opportunity of improvement with health is seek the right person.
Correct.
Don't seek the person that's just writing Ozempic prescriptions left and right.
Correct.
With no particular care or follow-up, with no understanding of the dynamics of an obese patient. With
understanding the dynamics of an obese patient. And it's interesting that you say that.
Yeah.
Because it is so many dynamics that come into play.
Oh, absolutely. So you have to understand that. You have to understand, where does this obesity come from? What are the genetic influences that have influence? What is this patient's macro environment? What is the macro environment that we all live in?
Their lifestyle.
What is the micro environment of this patient? And then what are some causative things that the patient's doing, like other medications? We've talked, ideas that I'm sure you've come across of medications that may be contributing, for example, to the challenges with weight loss.
As a side effect.
Correct. So as a side effect, correct. So there's a very elaborative initial assessment that is absolutely necessary to really begin to understand the dynamics of this weight loss journey that you're helping these patients.
And what about the ones that come and they don't really care about anything? They just want to lose weight. They're fixated on lose weight. They want a quick solution, and they're not going to listen to what you're telling them.
That's a tough patient, because obviously that's the majority of people in today's day and age. We want a quick solution. We think that the short-term solution is the best solution, and I want to lose from weight A to weight B, and then I'm done, and I can implement this strategy, and then I'm good. And that's just not how the body works. So the way that I approach those patients is to try to help them understand that first is, how comfortable are they with change? What are they willing to change? How well do they understand how they got that way? Also, what is the real need here? Is it that you want to look skinny?
Yep.
Or is it that you want to be healthy? Because there are patients that, let's just say, may not necessarily qualify for such aggressive management, aggressive maneuvering, pharmaceutical strategies or surgery or whatever. So all of those need to be on the table and explained to the patient.
And addressed.
And addressed, correct. A patient may not necessarily understand or may have a misunderstanding of the dynamics of what they're doing and how they're influencing their body. It may be a consistency issue in terms of calories in, calories out, exercise regimen, carbohydrate profile.
Right. What is their priority? To be healthy or to look skinny?
Well,
for their self-esteem?
I think both. Well, first of all, there's definitely some of that goes hand in hand. Obviously, a lower body mass index has a lower cardiovascular risk. Obviously, that is a skinnier person. But I try to stay away from that word because, especially at the beginning, body image is probably not the right way to approach a genuine desire to lose weight. So how genuine is this person? What are they willing to do?
Sorry, Manny, I want to stop you right there.
So sorry.
No. I just want to stop you because you bring up a point. I imagine some of your patients are coming in and they're struggling with their own internal demons, right?
Yeah. Correct.
Many of which have food addictions.
Yeah.
And so they're coming to you, they're dealing, and they're hoping that you are going to fix this problem for them.
Correct.
And then so much of your work, there's such a psychological component to it.
Oh, absolutely.
Because you have to teach them that I understand you want to look good.
Right.
I get it.
Right.
But it's all about healthy living.
Yes.
And switching, getting them to understand you have to do a switch of your mindset.
Right. So correct. So that what you're saying in a way is what is the reward that we get from our nutritional intake? And a lot of that plays into nutritional decision making. I talk a lot to patients about their nutritional decision making and what are their decisions really founded in. And you have to have good conversations, healthy conversations with patients. You have to have the time to have healthy conversations with patients, which is the biggest dynamic that we're really not talking about from a provider. Most providers don't have the time or don't want to designate that time, right, to have that conversation. But anyway,
do you then refer to a nutritionist?
So an elaborative, let's say, evidence-based program for weight loss has multiple disciplines in it. You have the physician, the dietitian, a behavioral therapy aspect, a pharmaceutical aspect, and a surgical aspect as well. So I have my referral source as well that we work together. There are a multidisciplinary approach. So if you think about how a provider treats chronic conditions in general, the old paradigm has been for many, many years to treat the chronic condition, whether that's diabetes or hypertension or even other depression, whatever other diseases that have obesity as part of the clinical picture, and the weight loss is sort of secondary. What the new strategies are, and what the smarter way to maybe approach this is to really put the obesity at the forefront. And if you're treating the obesity, then hopefully you reduce the risk of all of these other things. Obesity is associated with about 200 other diagnoses, right? So we can hopefully decrease that. So focusing on obesity weight loss, again, go back to that where I really realized this is what patients want to talk about. And as I began to focus on that more and more and more, eventually you do see a decrease in all of those things. So it's about really getting
domino
healthy.
effect.
It's a domino effect, exactly right.
Manny, I want to touch on men's health. As we know, we are recording this episode in June. June is Men's Health Month.
Correct.
For the men listening right now, first of all, how often should they be checking their testosterone levels? We know that testosterone levels, high or low, have been linked to depressive disorders. So how often should they be checked?
So it's not a simple answer in terms of this is how often you should check it, because that's sort of a non-evidence-based answer. So if you really are sort of strict by what is required, let's say, by evidence-based guidelines, there's no specific time or age where we are, let's just say, required to check testosterone. So, but my responsibility as a diagnostic provider, as a diagnostician, as a physician, is to think about, is testosterone part of the problem? So, you take your, weekend warrior dad who's in his 40s and his 30, 40 pounds overweight and maybe has a change in libido and is starting to have some erectile issues. Yeah, you better believe it. I'm checking a testosterone on that patient. Absolutely. You have to let the clinical scenario lead to, does the testosterone need to be checked?
Or the young men that they work out and you may be suspecting that maybe they're doing testosterone injections to boost their...
So that's a different animal. That's a different patient. That's somebody who, you have to have very difficult discussions about what are the potential long-term side effects and consequences of that.
And maybe they're presenting certain aggressive behaviors at that point.
Sure, yes, that can happen because it's testosterone. Right. So the correlation that you're talking about in terms of mental health and testosterone levels, I mean, this is a hormone that, really has massive psychological influences. Anybody who has ever watched their son go from 9 to 15 will tell you, holy moly, like this is a powerful hormone. So, what is the psychological effect of that hormone, I think is an important thing to think about. And as it fluctuates, because men, as long as they have functioning testicles, they will always make testosterone, right? So if the circulation is good and the testicles do what they do, the amount of testosterone that they may produce and the amount of binding of that testosterone to the proteins that circulate in your body changes over time. So less available testosterone, etc. So you should monitor that, especially in the right clinical scenario. In the guy that's injecting himself because he wants to, be big and strong, that's a different scenario where now you're checking because you're trying to maybe coach that patient back to the safer zone, let's say, where maybe this isn't such a good idea long term, and what is that doing not only from a psychological standpoint, but what are the physiologic effects of that, and what are the potential consequences. So as you start a patient on testosterone, if that is part of the problem, the risk benefits profile needs to be explained. They need to sort of understand the dynamics of that, and it should be monitored very, very, very carefully. It's a controlled substance in the United States, so you got to think about that.
Yeah. Manny, share tips for our listeners. What? Let's talk directly to the men that are listening right now, because we do a lot of
listen
episodes.
To your wife. That's the tip. That's
listen
tip
to
your wife. You asked me how often should a man go to? You should go as often as your wife tells you. That's the no. Just I think just general. First tip I would say is be careful what you read and who you listen to.
Okay.
Right? Oh my God,
putting out a podcast,
yes.
right? So make sure that who you're listening to as best you can is evidence-based, isn't just whipping things out from nowhere, and has the right educational doesn't have a secondary reason to be telling you what they're telling you, and speak to your doctor. If your doctor is not somebody who is comfortable about talking about the things you want to talk about, then you probably have the wrong doctor.
You might have to change providers.
Yeah, you might have to change providers or get recommended or go see a specialist or whatever. So seek the right information. That's the most important, probably the first thing. The second thing is don't underestimate the power of consistency. It's consistency that matters. So going back to the super strong guy that wants to inject himself with, testosterone to be super strong, like the intensity is not what really matters in terms of a weight loss strategy, in terms of change. It's what we do with consistency. So starting low and going slow is okay. We try to teach 150 minutes of exercise a week, but if you divide that out in 7 days, that's not a lot of time off your hands. And it's the consistency that matters. Getting into the habit and the routine.
Those small changes really the hardest every day. Correct. That'll make
that really will accumulate.
Realistic expectations and the patient, and to understand that everything takes time.
Right.
The same thing with the ones that want to lose weight and the one the Ozempic.
Correct. You're trying to change biology. Even if you do use Ozempic, or Manjaro or whatever, whichever one, right? Any of these GLP-1 agonists. As you use that pharmaceutical strategy, it should be explained to you. First of all, what are the potential consequences? What are the side effects? Or do you truly have indication for the medication? Who has absolute contraindications? Because there's a few, people with medullary thyroid cancer, et cetera, that should not take that medication. And then what are the expectations? It's important to explain that, because I almost want to see the side effects happen so that I can sort of understand how sensitive is this patient to the medication. And that could be a useful tool, by the way. But yes, the expectations need to be out there. They need to be realistic, because again, we go back to change and understanding how dedicated this patient is to change and long term. I tell my patients, listen, I don't want you to lose weight for a year or 2 years. My intention is to try to help you have permanent weight loss.
Correct.
And
lifestyle change.
Yes. And there are patients that require every modality, every lever that I can pull may be what you need, but it's not what everybody else needs. By the way, that's another tip. What works for your friend on whatever social media platform may not necessarily be what works for you.
I'm so glad you're bringing that up.
So you have to. It has to be individualized. Again, if you go to the sort of the factories of writing prescription warehouses that'll just write it without any sort of care, or and not individualizing your weight loss journey, that's a challenge. That's the wrong approach.
Absolutely.
You know, the right approach to try to achieve lifelong weight loss and to try to achieve permanent weight loss is
without
to really
the rebound.
understand, correct, because what if all this goes away? What if your insurance coverage changes? What if you're not willing to pay for it? If you're willing to pay for it, you may be willing to pay for it for a couple of months. You may lose X or Y amount of pounds, but then it's, you know, all that weight will come back as you stop with the GLP-1 agonism. So, you know, what did you learn? Another good question to ask patients if they do that, and many of them have before they come see me, is, well, what did you learn? Oh, I lost weight with blah, blah, blah diet. Was that the most successful for you? Oh, yeah. When I stopped having carbohydrates, for example, oh, I lost 40 pounds. Great. What did that teach you? And you try to prompt them in trying to reflect on their own success. And then you have to use that to their advantage. Okay, well, let's go back to that. Let's think about that. If this pharmaceutical strategy worked for you, let's bring it back and then add to it. 6, let's talk about your behavioral health. Let's talk about, you know, what is the surgical plan, because this may be temporary until we get you to surgery, you know, all that kind of stuff in the really severely obese patients. So we'll see.
Wow. No, I love that we have touched on so many different things, and I feel like our listeners have learned so much
I hope so.
from this episode. We want to have you back.
Okay.
Yes.
Okay.
We would love to have you back because
more things to talk about.
Yes,
Absolutely.
my head is spinning. I have so many questions. No, I just have so many more questions for you, but I know that we are running out of time.
That's okay.
So you know I'm going to call you.
That's okay. You can call me anytime. That's okay. As long as we can put, and again, sorry, just to, you know, one more thing about Francesco, like, you know, touching about that, that's very obviously very important to us, and the dynamics of that, and trying to really encourage families to not forget about yourself. If I don't pay attention to my own health, that hurts Francesco.
Right.
See what I'm saying?
And I want to ask you one last question before we go. No, because you just said it and you brought me right to what I was gonna ask you. So you never actually answered my question when I said, "What do you do for you?
What do I do
What is your coping mechanism for stress
and your wife and the family?"
Now, and again, things have calmed down tremendously. Finding times of peace and quiet, honestly, are for me the best.
That's what helps you to de-stress.
Very, 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 very humble and honored to work in a place that allows that and gives me the time and the freedom to have some quiet time. I pray a lot, you know.
So
I'm
prayer
Catholic
for you
by background, correct? So I rely on my faith a lot. So, you know, I find time to sit quietly and pray in particular areas that are consistent with my childhood memories, as a matter of fact. So I'm luckily enough, able to go to those places and spend time there. And that's been very psychologically rewarding for me. You know, my wife is just, you know, she's awesome. So, having time together, traveling, being together, trying to find some normalcy is really hard, but we do that. She forces me to do that. So, you know, that's really important for us. And as much as I may fight it, you know, it's good. And it helps us sort of, okay, you know, we fought this fight. Now we are rewarded with some level of calm and normalcy. So we try to do those things, and they can be very rewarding. Even if it's just 10 minutes, even if it's just sitting in mass, which we didn't do for a long time because of his seizures and behavior or whatever. Now we're doing that again. Like, that's, you know, we've come back to that, and that's been beautiful. That's been spiritually rewarding. You have to seek your own spirituality, no matter what faith or religion you are, and you have to really sort of seek the spirituality within, because hopefully that will guide you. And then, of course, I would be kind of silly to, you know, not say, talk to your doctor. And again, you know, if the solution is not always take this pill.
Correct.
Right.
You know, here's your SSRI, take it. That's the simple answer. Sometimes that's possibly part of the answer,
but
it's not necessarily it's not necessarily the complete answer.
Right.
Many times I have patients that have been on SSRIs or whatever medication, whatever, for years. And I feel better. I don't want to take this anymore. Well, hold on a second. If we start taking this medication off, what have you done in the meantime? Have you
tried therapy?
Right. Yeah. So where's the non-pharmaceutical balance to that? And so that's what I focus on. I focus on things that are not pharmaceutical, thank God. Happily, I guess I can say that I'm not relying upon any medication anyway to deal with anxiety or stress or whatever. I rely upon trying to seek peace and seek the grace of God and seek, opportunities for improvement and beating myself up as to what I can do better. Self-improvement, I think it helps massively.
Definitely.
Thinking about self-improvement, there's no end to improvement. We can always do better. We're going to try to do better every day from a behavioral health standpoint. We can always try to achieve. If I give up, that only hurts my family. As a dad, as a man, that's my role for my family, so
I lied.
I have to.
I lied when I said that was my last question. Because now I have one more question. And you bring up something, because I hear from so many men, right, that you are fighting every day, providing for your family, and you carry this weight.
Oh, absolutely.
And no matter what you're going through,
right,
tomorrow you have to wake up and do it all over again.
Yeah.
And I think you're amazing. And so maybe it wasn't so much a question. What I have to say is just, you are inspiring.
Well, thank you.
So many people listening to you. No, you are. You're inspiring so many people. And I just want to thank you, because your story, your journey, everything is incredible.
I got to say, again, I owe that to my dad, honestly. It was sort of how we all learned that as a family. My father was he was a tough guy, but probably only saw him shed a tear a few times, but definitely was, the pillar of our family. And why would I give my kids less? So despite the changes that, in my life I had to go through, it was all in the interest of self-improvement. I didn't like who I was, let's say, 15 years ago, and I implemented strategies to change. My kids needed to see that. Now they're almost adults, and now I can go back to them as they're learning how to be adults and say, you remember when that happened? Yeah, well, this is why. Because I didn't like where I was, who I was, what I was doing, how I was doing things, and I took it upon myself to say, I'm going to change things. And that included nutrition, weight loss, exercise, medication, studying, religion, whatever it needed to be, being a dad. I want to be a better dad. I'm not being a good dad. So let me go back to that. And that's why it's not just my testosterone is low. Maybe. But what else is going on? You have to take the time. It's one of the challenges with our current healthcare system, right? Like, you just don't have the time to talk to people. And you have to be a good communicator. If you're not a good communicator, you're doing the wrong thing. You're not really helping. I'm not here just to write prescriptions. I'm here to talk to people.
I have to say, to add to everything, I'm very observant.
Okay.
And when I see you after listening to your story, I can see your family, I can see your wife, I can see your father, I can see Francesco, and I can see that God gives you the battles that you are prepared to fight.
Oh, yeah, absolutely.
And not only that, He equips you with all the tools that you need. We want to create this podcast because we want to inspire people. We want to deliver that message that what I see is reflected in you right now. 2 of your kids are going to go to the medical field.
I hope so. One for sure. One I hope.
And I think
one looks like she's going to. The other one we'll see. No, just kidding.
If they can be as good as you are with your family, with your patients, you're the core of a lot of more changes that are going to be happening for a lot of more people. What you're doing for Francesco and the Epilepsy Foundation, I think that message needs to be out there, and we can inspire, we can teach the listeners that are maybe finding out about this for the very first time. And just how beautiful you speak about your family,
thank you.
about your wife.
It is truly
Sorry
inspiring.
that I talk a lot.
No,
No, it's inspiring. It's truly inspiring,
Right.
and your message is beautiful. And I think that it's such a powerful message, and you will help so many people.
I hope so.
I'm sorry that we have to end this episode because I have so many more questions, but we're going to bring you back.
Okay, that's okay. I think you know where I live.
I know where to find you.
That's exactly right.
So at this time, Manny, thank you.
You're welcome.
Thank you for being here with us.
Anytime. I appreciate it.
And for our listeners, we want to thank you because we know it takes time and energy to really listen to all these episodes, but we know that even particularly with today's episode, it's going to help so many of you. And if you want to reach out and have more questions for Dr. Torres, please, you can DM us directly. You can find us on Instagram, which is Breaking Barriers, the podcast. Again, it's Breaking Barriers, the podcast on Instagram. You can send us your questions and we will follow up with Manny and get you answers. And lastly, for our listeners that want more information, you can reach out directly to Epilepsy Alliance Florida. You can get more information about all things epilepsy resources. You can reach out to them directly. And if you want to reach out to Dr. Torres, Manny Torres, you can reach him also through Fight for Francesco and maybe get involved and help out the team that directly helps Francesco. So until next time, guys, thank you so much for being here. Bye.